Thank you for that introduction, Patrice. I am excited to be here today. Thank you for the invitation. I'm going to start sharing my screen because I have just a few slides to share with you all tonight to give you a bit of information about COVID-19. Oh, wait, having some technical difficulties. All right, are you guys seeing my screen okay? Can I get a thumbs up in the chat if you're seeing my screen? Screen okay? I'm gonna take that as a yes. So again, I'm Dr. Latanya Washington. Thanks for the thumbs up, guys. I appreciate y'all. If you guys would like to follow me on Facebook or Instagram, you can follow me. My handle is there. Happy to answer any questions that you guys may have that we may not answer during this session. So the purpose of this discussion is to focus on current medical updates for the COVID-19 pandemic. A little bit of housekeeping. All participant lines are muted. Make sure you submit your questions via the chat feature, and I'll try to answer those at the end of the presentation. Disclosures, I have nothing to disclose. I am not affiliated with any government entities or any pharmaceutical companies. This information that I'm going to present are the views of me and not representative of my employer or any sponsors of this event. And then also a disclaimer to know that this information is general information about COVID-19. It's not intended to be any kind of medical consultation, diagnosis, or treatment. If you require any medical attention, please go to your physician or to the nearest emergency department. So I like to start with the demographics. When we're talking about COVID-19 in the United States, the number of cases that we have here are 4,346,748. This information was from yesterday because I was trying not to procrastinate as I prepared this presentation. And so the current numbers are 4,401,599. And the number of deaths, the updated death rate from today is 150,090. So as we see these numbers continue to increase over time. And then since we are, I wanted to touch a little bit about children and COVID. Really at this time, we have 288,287 childhood COVID-19 cases, and this is the data as of July 23rd. 8.4% of all COVID-19 cases are in children. So that's an overall rate of 380 cases per 100,000 children in the population. There are some limitations to these numbers. This information is readily available on the AAP website. There's a link at the bottom of my slides, and I have links pretty much at the end of each of my slides where if you're interested, I'm happy to share those with you so that you can go back and review that information on your own. But the limitations of this were that not all states reported the number of childhood cases or the number of childhood deaths of COVID-19. And so really when they talk about the death rate, they have a 0 to 0.8% of all COVID-19 deaths were attributed to children. So there were no actual numbers available and more data is needed. So really when you take this 0.8% number and go back to this slide of the 4 million, so like 0.8% of that is really about 2,500 kids. We don't have those actual numbers, so that's just a rough estimate. So since we're in Tennessee, I wanted to share with you all the numbers for Tennessee. Again, this is from yesterday. I do have updated information from that too. But the total cases in Tennessee, 96,489 as of yesterday, and the total deaths of 978. It appears that yesterday was not a good day for COVID in the state of Tennessee, because now what is listed on the Tennessee state government website is 100,822 cases and 1,020 fatalities. When we look at this information, you know, we've heard a lot about the ethnic and racial disparities that we have with COVID, so I wanted to bring those out and list those here. Down in the bottom portion of the slide, you see that the number of Black or African American cases is about 19% of the total cases and about 34% of the deaths in the state. When we look at the population of Tennessee, Tennessee is about 17% African American, so we would really expect for the number of cases and the death rate to be equal to the population, and that's not what we're seeing. Also, when we look at the Hispanic and Latino population, which is over in the further right part of the slide, we see that about 17% of the cases and about 10% of the deaths for our Hispanic or Latino population as well. So then drilling down a bit more, because we are here in Shelby County, the Shelby County data has also been updated. This is information from yesterday. Really on the website, they have the same number, they have Tuesday's data on the dashboard here for Shelby County. So 19,694 confirmed cases and 263 deaths in Shelby County. And they list their racial information a little bit different. They put it in a pie chart. So when you look at the racial data, we see that 57% of the COVID cases are in African Americans here in Shelby County. And then in the ethnicity piece, 26% are of Hispanic or Latino origin. And then another thing that we wanted to talk about is the death rate. You know, initially when we started seeing COVID, we really were saying that this was a disease of older people, that older folks were being affected. And certainly the death rate reflects that, but also note that there are some people who are in younger age categories. Up here in the smaller sections, it's age 35 to 44 and age 45 to 54. So that's a younger population. And then when we go on to look at the number of people affected, really at this point, the younger population is more severely impacted at this time. And I don't have that slide pulled up, but if you go to the link that is listed on this slide, you can certainly see that information. So what do we do to keep safe? Basically, you know, we've heard these things throughout this time of COVID. We want to make sure we wear a mask, avoid touching your face. We want to stay 6 to 10 feet away from people. We want to avoid being in groups if we are feeling sick, and really avoid being in groups in general. And make sure that we clean and disinfect commonly used surfaces. And I'm going through these pretty fast. If you guys have any questions, make sure you put them into the chat feature, and I'm happy to answer those questions later on in the presentation. So symptoms, when we talk about symptoms, again, we've heard about this. Initially, when COVID was first discovered, we were really focused on the shortness of breath, the cough, the fever, the chills, but then we started hearing about loss of taste and smell, diarrhea, sore throat, headaches, muscle aches, like a flu-like symptom. Really, there are a significant number of symptoms, really too many to list here. Some patients have only have a passing out spell. Some people only have headaches. You know, this disease can really present in a number of different ways. And so what are the emergency warning signs? So those signs are if you have any trouble breathing, if you have any persistent pain or pressure in the chest, if there's any new confusion or inability to arouse, headaches, difficulty speaking, blurry vision, any bluish lips or face. This is not all inclusive. If there are any conditions that you are concerned about, then it's very important that you seek medical attention, whether that is calling 911. Of course, if you're having difficulty breathing, then you should call 911 and you should get to the nearest emergency department. So I want to take an opportunity to talk about testing. We've heard a lot about testing in the recent weeks. Initially, when we started talking about COVID, they had multiple different tests that you were able to obtain. So the viral test tells you if you have the current infection, and they have the PCR test that is available. So really, that test is only about 70% sensitive. And so for lay people, what that really means is that if I have 10 people in front of me that absolutely have coronavirus, and I test all 10 of those people, then probably only 7 of them will have a positive test, even though all 10 have the infection. And so then when you hear in the news where they're talking about if you have these symptoms, then you should be a presumed positive. So that means that even though you have all the symptoms of COVID-19, if your test is negative, you should still assume that you have it and assume that you can transfer it to others. More recently, there have been delays in getting test results. Sometimes the test can take up to a week to get back. If you can imagine, this really kind of puts a damper on things. If patients are in the hospital, then that's not such a big deal. But if you're at home and you're waiting for your test results, it's kind of difficult for patients to understand that they should stay home while they await their test results. But it's very important that you do so, because if you were out and about and then your test comes back positive, then not only did you expose the people before you got a test, but then also all the people during the time when you were waiting on test results. So that's the thing that is really important, and that's one of the key points that I wanted to make today. The next type of test is an antibody test. That test tells you if you had a previous infection. The test is not as widely available. Also, it has low sensitivity, and there are numerous test vendors. Basically, what the antibody test tells you is that have you had COVID-19 infection in the past, whether you had symptoms or not. The information, we don't really know how to use it at this time, because just because you have antibodies to COVID, we know that that means that you are immune for a certain period of time, but we really aren't able to say how long you'll be immune to it. What they're pretty sure of is that at this point, they're pretty sure that it's not a lifelong immunity, and they really think it's only about a couple of months. So really, that's a game changer, and it's important that as healthcare providers, we don't give people a false sense of security saying that they can't get COVID again, and then they kind of let down their guard in regards to the safety measures. So treatment, I definitely wanted to talk a bit about this, particularly with everything that has been going on in the media as of late. Number one, there is no current cure or vaccine for this disease. They have several clinical trials that are underway. The medication remdesivir is an experimental antiviral drug, and the FDA has granted emergency use, meaning that they can use remdesivir for the treatment of COVID-19. Remdesivir is only available for hospitalized patients, and not every hospital has this medication. Also important to know is that there's not an abundant supply of this medication as well. A lot of people have been using steroids, and they see some benefit in that. There have also been plasma antibody trials or utilizing convalescent plasma, meaning if a patient has had coronavirus infection and recovered from it, then they are able to take plasma from that patient and give to someone else who's actively fighting the infection, to see if that causes any benefit, and for vaccine development. So vaccine development is something that we've heard a lot about this week. They started phase 3 clinical trials for the vaccine earlier during this week. So that will be a period of time where they will determine how effective that vaccine is and if it has any side effects. Notably absent on this slide is treatment with hydroxychloroquine. I know that that has been very prominent in the news. As of late, there are published studies saying that this medication is not beneficial in the treatment of coronavirus infection, and it also has a multitude of side effects, and so it is not currently recommended. And I'll talk to a bit about that, more about that later. So I put this slide in here, danger, proceed with caution, because it's very important that we think about, as healthcare providers and as lay people, while we are gathering information about this pandemic and about really anything that concerns health, that you seek updates from reputable sources. It's very important that you don't get all of your news from social media, that you should also consider the source when you're gathering data. You know, a Facebook search, a Google search does not constitute expert research. And then also, I know that this week there was a video of doctors who were stating that the hydroxychloroquine was beneficial, and in their treatment of patients, they saw that there was some success in those patients, and those patients recovered. Those are what we call anecdotal studies, and or not studies, or and just basically anecdotal. And those, that's not the gold standard. So the gold standard for medical care, how we come up with standard practices, is really from double-blinded, randomized, controlled clinical trials. And for the people who are online who are not medical at all, basically what that means is the double-blinded portion means that if we want to test patients, for example, that have coronavirus, we want the study to be double-blinded. So that means that as the doctor, I don't know exactly what medicine I'm giving you. So I don't know if I'm giving you hydroxychloroquine or the placebo. As the patient, you don't know whether you're receiving the hydroxychloroquine or the placebo. And it's completely randomized, meaning that we don't have one patient hydroxychloroquine, one patient placebo, where as physicians or patients, we can figure that out. And that these studies are conducted in a controlled setting. So that's a double-blinded, randomized, controlled clinical trial. And so for most medications that are produced and FDA approved for treatment of various conditions, they have been studied in this manner. And so that's usually what we utilize. All right, so my next slide is, you know, we've heard a lot about COVID infections, and the truth is that most of the patients who have coronavirus infection will recover. However, we do not know what the long-term effects of this disease are, because it was just discovered in 2019. So we don't know what a patient is going to look like 5 years post COVID-19 infection. However, what we are seeing, and from the information that we've been able to document, is that many patients have a post-infectious sequelae, like they may have fevers for an extended period of time. Patients have also reported that they've had weakness, that they've had prolonged headaches, I spoke about the fever. There is a lot of data that's being published currently about cardiac toxicity and cardiac damage that is being caused by COVID. One recent article I saw said that 80 to 90% of the patients who have had COVID-19 infection, if you do an evaluation of their heart, like an ultrasound of their heart, that it looks like those patients have had a heart attack when actually they only had COVID-19. A lot of patients report constant anxiety after their procedure. They report worsening chronic diseases such as asthma. People who had in the past had well-controlled asthma post-COVID-19, they're having more significant symptoms. I have a few people that I know who have had COVID, and they say that they have extreme fatigue post-infection. Neuromuscular dysfunction just means that they could have weakness or muscular symptoms that they cannot explain. Some patients can look like they have had a stroke. A lot of patients who have had COVID infection have renal impairment. A good number of the hospitalized patients end up having chronic renal impairment. Some of those patients have had to have hemodialysis. And then clotting abnormalities. I am involved in a lot of physician communities that talk frequently about COVID. There was one case that was posted this week that was really very, very sad. There was a young patient who had COVID infection. The patient had improved to the point where they were able to get out of the hospital, but then started developing like blood clots in various places. They actually developed blood clots in the blood vessels that were supplying the eye. And so that patient ended up going blind, and they're not sure if that patient's vision will return. So there are a lot of different things that this infection can cause. So, definitely be mindful of that. We had heard a month or so ago about people having COVID parties where someone who was known positive would host a party, and people who were negative would come so that they could go ahead and get the infection. That is not smart. We really don't have a way to understand who is going to have severe illness and who is not. And so with that being said, I know that I'm working every day, and in my hospital, we have very young patients who are COVID positive, who are not doing well at all and who may not make it. And then we have some patients who are very old. I think there was a 90-year-old patient that had COVID and was able to walk out of the hospital. We just don't have a good idea of who's going to get very sick and who is not. So when we talk about reopening, here in Memphis, they've talked about businesses and schools reopening. It's very important that we follow our state and local guidelines, ensure distancing, avoidance of gatherings, require masking. I know this week, Memphis and Shelby County have started they had started the Mask Up campaign earlier in the week, but they did also have videos and commercials about mask up, like public service announcements. Excuse me. It's important that when you go into businesses, they provide an area for hand sanitation. If they don't, make sure you carry your own hand sanitizer. And for businesses, they should ensure frequent cleaning of high traffic areas and high touch areas. So as far as schools are concerned, I know that they were talking about the virtual versus in-person learning. A lot of schools have delayed their start time. I have talked to multiple administrators in various school systems across the country regarding advice as far as what they should do. A lot of school systems are leaning towards the virtual learning, and I believe that for Shelby County, they opted for the first semester to be virtual. I think that that's a good choice. You know, there's still just a lot of information that we don't know about this infection, but I think that without having a distinct plan on what to do if somebody becomes sick, you know, how that would look in schools, like if the teacher is sick and the teacher is out, or if students are sick and they have to be out, or you have to quarantine an entire classroom, you know, how do you go about doing those things? And there are lots of complexities involved there. So that's something to consider. So virtual learning caveats. You know, when we talk about schools reopening, we have to understand that not every child has access to a computer or a tablet or internet connections at their homes. And so when we talk about no child left behind, and that's our goal for the education system in this country, we know that for a significant number of children here in Shelby County, that may not be the case, and really across this country. And so we really need to have plans in place to be able to provide these kids with devices so that they will have the ability to learn. Then there are times when, you know, in-person schooling does allow for emotional development. A lot of kids get their main meals at school. So with the schools being closed, they don't have that option. So a lot of kids are not getting adequate nutrition. Also with the physical education piece that's in most schools, kids are able to become more active. That may not be an option at home, particularly if they don't have a designated outdoor space or if it's unsafe. I've also had a lot of questions about travel. For those that don't know me, I am an avid traveler. So I wanted to include this slide about travel. So you have to ask yourself a couple of questions. You know, should I go on this trip? And the questions that you have to answer is COVID-19 spreading in the place that I'm going? Like, is that place a hotbed area? Or is COVID spreading in my community? Is it a chance that I could be asymptomatic and I could be going to this community and taking COVID with me? Are the people that I live with or the people that I will travel with, are they in a high risk group? You know, do they have some of those comorbid conditions? Are they elderly, where we would be concerned that if they get sick, that they may have a severe form of disease? And then, so when you're deciding whether to go, does your home state or your visiting state have a 14-day stay at home requirement? So if I say I want to go to New York, New York has a 14-day quarantine requirement. So I may be able to get on an airplane and go to New York, but I'm supposed to quarantine for 14 days when I get there. Well, if you are like most people, I know I am like that I don't necessarily get 2 weeks of vacation, and I would want to enjoy New York and not have to be quarantined to my hotel room. And then also, if you're your home state has a stay-at-home requirement, meaning that when you get back, you will have to stay at home for 14 days, meaning you also will not be able to work. So how do you go safely? Number one, protect yourself by wearing a mask at all times. Number two, consider the addition of eye coverings for any travel like air, bus, or train travel. And when I say eye coverings, I mean safety glasses or safety goggles or a face shield, because we know that this virus is spread by droplets. So not only can they enter through your nose and mouth, but also through your eyes. And then also notice that car travel is not without its own set of risks. That risk is less, but when you're stopping along the way for gas, food, and restroom breaks, you also put yourself at risk. And then it's also very important to anticipate your travel needs. So for patients who have chronic conditions, I tell them to make sure they take all of their medications with them when they go, to have enough medications for your entire trip, as well as some extra if your trip is extended unexpectedly. Also, you know where the nearest hospitals are. make sure, you know what the requirements are for that state and that your needs will be able to be met while you're there. So what to do? Basically, it is everyone's responsibility. We have to be socially responsible. You have to protect yourself and those you love. At this point, when I interact with anybody, I assume that everyone has COVID, everyone that I'm coming into contact with. It's important that you stay home when you don't feel well. It's important that you seek medical care for any concerning conditions. It's important that you get tested if you've been exposed. And again, I will say, if you get tested, you need to stay home until you get those test results back. And then you need to quarantine if you have any symptoms. The other thing that I will say is that, a lot of people have been diagnosed with COVID and they're positive, and they feel like they shouldn't notify others, or they're ashamed to notify others. If you are going to be ashamed to notify someone that you tested positive for COVID, then you don't need to be around those people. I have talked to multiple people, and I told them, we have to kind of treat COVID similar to a sexually transmitted infection. And so I've been telling people, you need to keep your body count low. And what that means is making sure that the people you're around and that you're contacting, that you know who those people are, number one. That if somebody comes to me and they say, okay, in the past 2 weeks, who have you been around? I can provide that list. If you aren't able to do that, then you're around too many people. That's very important, and you have to consider people, not only the folks that you're around, maybe they will be okay, but they may live with someone who's in a high-risk group who may not be okay. I know that we all know people who are immunosuppressed. We all know people who have diabetes, high blood pressure, heart disease. Those people are at increased risk for worse outcomes with COVID-19 infection. Here's a list of my resources. Again, I'm happy to provide those to anyone who is interested with the links. And now I will open it up for questions and answers. So I'll switch off my screen sharing to be able to do that. Do you guys have any questions for me? Happy to answer them. You can include them in the chat, or I don't know, Patrice, how do you want to do the questions?
We can, if you want to do like the hand raising, we can do hand raising.
Okay.
And then if you want to turn on your video, you can turn on your video. So you can ask your question. Now monitor. So if anyone has any questions from the chat, I will read those questions off.
Okay.
And we're also on Facebook, so I don't know.
Oh, I didn't realize that.
I got it on there.
Okay. Y'all are a quiet bunch. No questions?
So I have a question. Because I'm having what I think I am the crazy parent. I think people may think I'm the crazy parent when it comes to like the daycare. I am trying to train my 2-year-old to wear his mask. Everybody at the daycare wears their mask, and that's fine with me. But some of the kids, I don't think some of the parents realize that the children should be trained to wear masks as well, especially the bigger kids, 3, 4, 5, 6, 7-year-olds. My daughter, she's 5. She wears her mask fine. But my son, I put it on him on the weekend just so he can get a feel for it. What do you think about that? I know a lot of people are trying to prepare their children to go to school. So in my head, school is the same as daycare. You're still going to get exposed to children who I don't know what their parents are doing. I don't know, who they're hanging out with on the weekends, or you know what I mean? So what's your advice as far as masking of children in any situation?
Yeah, so really the current recommendations are for kids over the age of 2 to be wearing masks. Now, I realize that that is easier said than done. A lot of times children don't necessarily want to keep the mask on. But I think, Patrice, that what you're doing is the thing that is the best. Help them to kind of get acclimated with wearing the mask while they're at home so that they can, get comfortable with it. Because the truth is that, wearing a mask is very different than anything that we have done before. And, for a young child, it will be difficult. I think it's important to explain to them like why they have to wear the mask and why it's important, you know. So that's really what my recommendations are for masking. It is important that, you show them what they're supposed to do at home. And when you're going out, it's important to model that behavior that you want your kids to carry on as well. But recognize that not everyone is going to do that. And so it's also important that not only are you teaching your children to wear masks, but teaching them that the distancing is important as well as the hand washing. So that when your child goes into the school setting, they'll say, no, you're supposed to wear your mask all the time. You're supposed to make sure your mask covers your nose and mouth. You're supposed to wash your hands, and you're not supposed to get very close to me. You're supposed to be 6 feet away. So that's really the best way to handle that.
Okay, so we have a couple of questions from Facebook as well as Zoom. So I'll ask the Facebook questions first. Do you suggest wearing a mask when exercising outside, such as walking, riding, etc.? Riding a bike. I'm sorry.
Right. So I think that if you are walking or riding a bike outside, if you can ensure that you're not going to be within 6 feet of distance of someone for a time period of greater than 15 minutes, then it's okay to not wear a mask. I mean, I get it. It's Memphis. It's almost 100 degrees outside, and exercising, it's a challenge to exercise. Number one, I know for me. And then if you want me to wear a mask outside, then that's going to be another challenge. So, so all of those things, come into play. If you can ensure that you're not going to be in contact with folks, then you should be okay without the mask on the outside. But now if your exercise involves you going into crowds, if you're working out at a fitness center, then you most certainly should be wearing masks at that point. Any enclosed space, you should wear masks.
Okay. Second question from Facebook. What if the symptoms of the virus mirror those of lupus? Is that what? Okay.
So yeah, I was actually talking to my sisters a few days ago, and we were talking about COVID-19 and just the number of symptoms that it can cause, and how it can cause all types of symptoms. So really, the disease of lupus, we call that, and when we studied that, in medical school and in treating patients, we call lupus the great imitator, meaning that it can have a number of symptoms. So most certainly those symptoms of lupus there can also be COVID-19 symptoms as well. And so it's important to recognize that if you're having symptoms that are at all different than those that you usually have, it's also possible to have lupus and have COVID as well, because we know that a lot of the medications that are utilized to treat lupus causes patients to be immunocompromised or their immune systems to be suppressed.
Okay. Okay, so we have questions from Zoom. What about the issue of methanol in hand sanitizers? How should people check them?
Yeah, so someone sent me a text message today about their hand sanitizer, and that it was on the list of the recalled products. So the FDA has put out a list of recalled hand sanitizer because it has methanol in it. So just to let you guys know, normal hand sanitizer is isopropyl alcohol. Liquor that you would drink is ethanol. Then there's methanol, which is a byproduct of those, usually filtered out during the process. Methanol is alcohol that is actually absorbed through the skin and the body doesn't process it well, and it can cause some toxicities. So that's why they are recalling these hand sanitizers that are shown to have methanol. From my understanding, these sanitizers are not going to have methanol listed in the ingredients. So I would just do a quick Google search and say recalled hand sanitizer products. I looked at that list earlier today, and it does give you like the name of the sanitizer so that you can check what you have. I have a friend that said that she spent a lot of money on hand sanitizer, and she found out that the one that she purchased was on the recall list, and she had to throw it all out.
Okay. Let's see. Let me scroll down. Should you have people who aren't immediate family in your home?
Oh, that's easy. No, you should not. The reason is that so your family, the people who live in your home with you, that's like your little nest. People that are coming out that are coming from outside can bring the infection in with them and cause your entire family to get sick. By the same token, if someone in your house has COVID and someone else comes in, then you're exposing them, and they in turn go back home and spread it to their entire family. So that's pretty much the gist of that. I am not having people who don't live with me inside my home at this time. I don't take visitors.
Okay. How soon post-infections can antibodies be detected?
Yeah, that's a really good question. So usually the body makes antibodies to fight off infection. So we can find some antibodies during your active infection, and then we expect those levels to go up as you continue to recover. So really, during your active infection, the antibodies can be present. Now, they may not be at a high level, and it depends on the sensitivity of the particular antibody test that you're getting, because they make those tests in the lab that will detect a certain level.
Okay. Do you have any suggestions outside of elderberry and multivitamins to give our children before going to school?
So, not really. A lot of people, and I personally have also been taking vitamin C supplements. I've been making sure to take vitamin D supplements and zinc supplements. So those are some things that, have been noted that can be helpful to prevent infection. So I do those things.
Okay. There's so much misinformation and lack of information about quarantine. Can you explain the quarantine period if you come in contact with someone who is positive, but you test negative?
Yes, I will. And I'm going to look it up because I feel like it changes like every few days. So last week when I looked, so what the CDC recommendations are is that if you have been exposed to someone who has been COVID positive, is that you should quarantine for a period of 14 days. However, Shelby County did release a guidance last week, I believe it was, saying that self-quarantine period should be 10 days. And so when you say you're quarantining, it's also important to understand that also means from people in your own home who didn't test positive for the virus. And so what that looks like is kind of being confined to a specific room. If you have to share bathroom spaces, make sure that you as the person who is infected with COVID, that you are cleaning everything very meticulously, particularly bathrooms, kitchens, things like that. It's important to do that. Also, make sure that you are not sharing common household things. Make sure that your dishes are sanitized. Make sure that your you use the dishwasher or you use bleach when washing dishes. Make sure that you're washing the clothes of the person who's infected separately. Those types of things. Another thing is that this is for when kids go to school. As healthcare providers, I will tell you what my routine looks like when I'm coming home every day. Teachers who were concerned about starting school have asked me about this as well. When I come home, I pretty much get undressed in my garage. Everything that I wore outside my house to the hospital, I take that off and I leave it in a basket outside in my garage. I take my shoes off. I leave them at the door. I don't wear shoes in my home that have been outside. I immediately come in. I don't do anything else. I don't eat. I don't greet anyone. I immediately go to the shower. And then I put on fresh clothes. So that's my routine every day. The items that I take with me to work, I don't particularly bring in my home. If I do bring those things in the house, then I'm bleaching everything down, including cell phones, keys, things like that.
Okay. You spoke about false negative test results. Is there data or has there been any reports of false positive test results?
So I haven't seen any published information about false positive test results. But what I will say is that, all of these steps in COVID testing are subject to human error. So meaning that, just the way you can have false negatives, you can certainly have false positive results. If they swab a patient, two patients with suspected COVID, and they don't label the samples appropriately. I heard one person posted on social media that there was a lady who had gone to the drive-through for testing, and she left out of the line, and then somebody called her and told her she had a positive test, but she didn't actually get tested. Now, the way that can happen is if there are multiple checkpoints in the line and every person that they're encountering at that checkpoint is not checking with that person to say, is this your name? Is this your date of birth? Are you this person? Then that's certainly how that can happen. Once you get to the lab, if samples are contaminated, then that could also cause some false positive results. But pretty much at this point, I would say that if you thought that you had enough symptoms to be tested for COVID and your test is positive, then you should presume that you have COVID.
Okay. Any other questions? Let me check Facebook. Okay, I don't see any more questions on Facebook.
You guys had some really good questions. I will just say that in my closing remarks, please stay safe. Please make sure that you are getting your information from reputable sources. Overwhelmingly, I saw this video that was circulating on social media about people saying that, COVID wasn't real and people weren't actually dying from it. And if we just treat people with this medication, then things will be better. And, the one thing that I will say, you can look online also, they have fact check for those doctors. Those doctors are not treating patients who are in the hospital. So by definition, they have a milder disease. you know, it is likely that those patients would have improved whether they were treated with this particular medication or not. And then, you know, I know one of the doctors on the video said that all of their patients were cured, over 300 patients. However, most of the time when patients decompensate and end up going to the hospital, they don't call their doctors back to let them know that they had to seek hospital care. So I would say that there's not a lot of science behind that. And then I'll also say that, you know, it's very difficult for us as physicians and healthcare providers. I know there are a lot of pharmacists who are on the line as well. You know, we put our lives at risk every day for these patients. You know, if there was a miracle drug out there, trust me, I would be shouting it from the rooftops because I want this to be over and us to go back to a normal life just as much as everyone else. And so it's very disheartening when we hear those types of things. Make sure that you are educated on things. Make sure you listen to people who are degreed, credentialed, board certified, who have seen these patients in the hospital setting. And they will be able to provide you with meaningful information that you will be able to use. I will say that, you know, for me here, I feel like the language that I'm using in attempting to educate people has been very, I've not used complex medical terminology in a way that such that everyone can understand. If you follow me at all on social media, you will know that my message has been consistent since this has started, as well as, you know, the message of all of my colleagues. So really take that to heart. Make sure you are staying safe. Wear your mask when you're outside of your home. Make sure you wash your hands or using hand sanitizer regularly. Avoid touching your face, and make sure you are keeping a distance from others. And then before we close, one other thing is that I've seen a lot of people on social media posting where they're only wearing like the face shields and they're not wearing a mask. So the one thing that I will say is that if you are only wearing a face shield, then you are not completely protected. When you look at those face shields, they are covering like your face here, but they're open around the sides. The respiratory droplets and viral particles can still go around those and get into your nose and mouth. And so you are not 100% protected. So if you have to choose one or the other, then it's important that you choose the mask over the face shield. If you have both, do both. But if you only have to choose one, then wear your mask and make sure that that mask is covering your nose and your mouth.
Okay, I'm sorry, Dr. Washington. I have one more question. She snuck it in on Facebook.
Okay.
Can too much use of Lysol or different types of sanitation methods harm nasal cavities or irritate skin?
Yeah, it can. You know, there are some people who are sensitive to those things. And then the Lysol spray is aerosolized. So some patients that have respiratory conditions or asthma or allergies can sometimes have reactions to that. My suggestion would be to make sure that when you're using those products that, you know, you're in a well ventilated place. If those products are causing you to have some respiratory irritation, wear a mask when you are using those, but it is still very important to sanitize all your surfaces.
I think that's it. No more questions from Facebook.
Okay. Well, thank you so much for inviting me. I am very appreciative to the Memphis chapter of the National Pharmaceutical Association for this invitation. I hope that you all have found this to be informative. I'm happy to answer any questions. Like I said, if you guys would have more questions that you think of after this is over, I am on Instagram and Facebook at Dr. LaTanya Washington. You can send me a message and I'm happy to answer those questions at any time. So thank you and have a good evening.
Thank you, Dr. Washington. So that concludes